When we deal with people, 9 times out of 10, they're in crisis. People don't call us on a great day just to tell us things are going well.
But the definition of crisis has shifted a bit in Captain Weineger's 25 years on the police force. Today, the majority of calls Boise police officers are handling deal with mental health.
We go to dozens and dozens of those calls every week,
which has prompted changes and updates to the training police officers once knew.
We have our academy, and then we have a field training program.
After academy, they go one-on-one with a training officer, spending several months out on the streets in real-life situations.
Once that's through and we're confident that they are ready to meet those challenges and tasks on their own, then and only then will they be placed out on the street in a patrol car.
And at some point early on in their career, officers are trained in 40 hours of crisis intervention training. Then when the call comes, officers are trained to approach every situation as if someone is in the midst of a mental health crisis.
I guess the easy to spot, somebody talking to themselves or clenching their fists and angry without a stimuli.
But as has always been the case, their first and foremost goal is to ensure safety for the public.
We will address things like weapons, threats, before we assess whether somebody's in a mental health crisis.
And whether or not they're in the midst of a mental health crisis, de-escalation is the primary tactic.
De-escalation works for all of those things when it works.
But sometimes it doesn't, and it's in those cases where officers have to use their last resort.
Sometimes force is obviously necessary, and I guess that's why they call it law enforcement. But certainly that's not our goal, and it's not our number one thought when we go into a situation.
McKenna King, 6 on your side.